What's going on is that their brain can't cope with the stress, and it manifests throughout the body. So headaches, abdominal pain, bedwetting, constipation, soiling of underwear, pulling their hair, head banging, behavioural disturbance, fighting with the other children when they hadn't been like that before. And some of these kids have spent a large proportion of their conscious life in this environment.
What was really most distressing for us as paediatricians, because we knew that the environment, the detention environment, was contributing to this, was that many of these children had self-harmed or were talking about self-harm, whether that be swallowing a detergent, cutting themselves, trying to hang themselves, jumping off a building. You know, it's really distressing to see young children performing these sorts of acts. And I know that some people have said that these are just attention-seeking gestures, whether by children or adults, without having any understanding of the extent of the trauma that these people have suffered, and the fact that, you know, young children don't usually threaten or attempt suicide or self-harm. And particularly when we went to Christmas Island, at the visit that I did with the Human Rights Commission in July of last year, there were 15 women who had attempted suicide, all women with young children. Those women, at the time we were there, 10 of them were on 24-hour watch by guards. These were male guards, big burly male guards, not mental health nurses, watching these women through the open doors of their tiny little 3x3 metal room, watching them as they tried to sleep, as they tried to feed their babies.
And when I went to Nauru just for 5 days to see children, I knew what I was expecting to see, and I was still horrified by it. The reality of seeing it, of witnessing people's distress and what we're causing them, is shocking. And to be honest, I think that prolonged detention without knowing what's going to happen to you is a form of torture. To traumatise people and make them anxious at a very young age risks it being a lifelong harm. And it's a frightening thought that we are causing that. Now, people will say, surely the boat journey itself is frightening, and it is. Surely what they witnessed in their own homeland is frightening, and it is. But what we know is that if you compare people who've been in detention with people who have not been in detention, it's quite clear that prolonged detention increases the risk of mental health problems, and the longer the detention, the greater the risk. So it's a deliberate harm, and it's torture. And there's a real viciousness about that that is incredibly worrying. That's not what you expect of a caring country, of a country that prides itself on being civilised, anything but civilised.
International Health and Medical Services are a private profit-making company that are funded by the government to provide healthcare services on the islands and to a small section of asylum seekers in the community. So they provide healthcare services on Christmas Island, Manus, Nauru, and a section here in Australia. Part of IHMS's contract with the government is that they have to send a paediatrician to the island for 5 days every 3 months. So there's no specialist paediatrician there any other time in the 3 months, just 5 days in every 3-month period. So you've got IHMS that are a private profit-making company that are making over $1 billion a year in a system that the United Nations has said, well, they've been over there a couple of times now, both in 2013 and more recently in 2015, and have explicitly said that they feel that what is happening on Nauru is torture. Now, I went to Nauru with no agenda, literally as a nurse from a refugee clinic here in Sydney, to go and see children and treat children. Not in your wildest dreams do you ever expect to see people physically abused in front of your eyes. And I was only there for 5 days. I can't imagine what is happening to the minds of those that have been there for years.
And when there was a gap in my consultation, I said, well, let's go and see the living conditions, and I was barred. So I asked the IHMS officers in Nauru, I said, you know, what's going on? I was told this wouldn't be a problem. And they said, no, you can't go because this is a sensitive issue for the government. So we have medical organisations not looking after the best interests of the patient, but looking after the best interest of the government, which is contracting them. And this is one of the issues we have in Nauru, is you can't get there, you're not allowed in, the reporters aren't allowed in, and so the Australian public have no idea of the reality of what's going on here.
The EU have a ruling of a maximum of 7 days for a child in detention. The average stay for a child in the UK in detention is 5 days. We have an average stay of 15 months here. What I really want from this is the Australian public to become more aware of the damage that this is doing, and that other countries don't do this. They just do not. There is a better way of doing this. We don't have to lock children up on remote islands behind barbed wire to achieve what they want to achieve.
If they're just fleeing and trying to improve their economics, trying to get a better life, well, I did that as a young man, came from England to Australia, and I was legally doing it, if you like. But if people are doing it and bypassing other systems, then they need to go home. But that can be done quickly and humanely and firmly and still be successful. The others, who are genuine refugees, if you like, or meet the criteria, international criteria for being refugees, should be processed quickly. Then you have to decide what happens to them. Can Australia cope with 20 million refugees? Of course we can't. So we're going to have to put some limits. We can argue about how many people are going to be accepted here as genuine refugees, and we can be generous as we are at present, but the way we treat asylum seekers is truly reprehensible. It's shameful, and we should be ashamed of that, and I am ashamed of it. It makes me ashamed to be Australian. And I'm proud to be Australian generally. I don't want to be treating people in that way.
The way I see it, Australia is the sort of country that goes to war to get people out of these conditions. Australia didn't used to be the sort of country that would do this.